Hello, I'm Neil Barnard from the Department of Oral and Maxillofacial Surgery of the Western Cape. And I've been asked to talk a bit about medical emergency protocol, including CPR, in the time of the COVID pandemic. Yes, as we know, COVID is caused by severe acute respiratory syndrome coronavirus 2. And it's said that COVID has a fatality rate of 3.1%, and that the spread of this virus is airborne spread. Currently in South Africa, we are performing level restrictions, and every month it seems we're going down a level, and with every level going down, we are allowed to perform more and more procedures. More and more procedures mean more and more patients, and more patients then lead to the higher possibility of us having to deal with medical emergencies in the dental office. This is just an article that I found in the Scientific American, where they remarked about the US Center for Disease Control and Prevention and the World Health Organization. They say that the novel coronavirus is primarily spread by droplets from someone who is coughing, sneezing, or even talking within a few feet away. But anecdotal reports hint that it could be transmissible through particles suspended in the air. This is now the so-called aerosol spread that they are talking about, that has the whole dental community very worried, because they say that the dental drill causes aerosol. Aerosol spread falls under the umbrella term airborne transmission, and it refers to transmission of a pathogen via aerosol. This is then usually tiny respiratory droplets that can remain suspended in the air, the so-called droplet nuclei. This is now compared to larger droplets that usually just fall to the ground within a few feet, and this is the whole rationale behind social distancing. There are a handful of studies that suggest the new coronavirus, SARS-CoV-2, can exist as an aerosol in the healthcare setting, but much remains unknown about whether the aerosolized virus is infectious and what amount of virus one needs to be exposed to in order to become sick. This is known as the minimal infectious dose. Even if aerosol transmission does occur, it's not clear how common it is compared with other transmission routes, such as droplet or surfaces. Now, this is another article in the New England Journal of Medicine, and they mention that the infectious SARS-CoV-2 virus can remain in aerosol for at least 3 hours and for several days on various surfaces in a laboratory setting. But then they go on saying that the amount of viable virus diminished significantly during that time, and scientists do not know the infectious dose of SARS-CoV-2. So even after a few hours, there might not be enough viable virus particles to infect a person. And if it's now even in aerosol, there's even less amount of viral particles. So it's very difficult to say that if a dentist is working with a drill, that the whole area is now a very high infectious risk. The literature has not supported a lot of these views, but time will tell still what is going to happen. This is another interesting article that I found about cowling, that many respiratory viruses can be spread through the airborne route, but that the degree of contagiousness is low. Now we're talking about contagiousness. We're talking about the seasonal flu. The R0 value, which is a value that's a technical designation for the average number of people a sick person can infect for the common flu, is 1.3. Now, COVID-19 is estimated between 2 and 3, though possibly now some people say as high as 5.7. COVID-19 is still nothing compared with measles, for example, that has a R0 value of between 12 and 18. And this is definitely something to think about, where this virus falls in the whole infectious spectrum. This is just a slide that I got just to demonstrate the difference between droplet and aerosols. You can see when the droplets are smaller than 5 microns, it's regarded as an aerosol, and when it's larger than 5 micrometers, it's regarded as a droplet. So this is obviously then a whole spectrum of different sizes that are floating around in the air when there is a patient around that's COVID-19. But the infectiousness varies a lot, yeah, it's still debatable how infectious aerosols are. Then now coming to medical emergencies, we are now moving through different levels with regards to the COVID pandemic. And medical emergencies are going to start happening again. And this is an article that was written in 2015 in the South African Dental Journal, and they looked at what the most common medical emergencies are. This is what it showed, that by far the most common emergency occurring in the dental office is a vagal syncope, the common faint. There are various other things. You can get seizures, more serious anaphylaxis, very serious cardiac arrest. And then obviously there are different procedures that need to be done to manage these conditions. Some are going to be aerosol producing, others are not. So a strict protocol for medical emergencies is very difficult, and it has to be guided by what the medical emergency is. This is from the same article in the South African Dental Journal. Just looked at some of the skills that are used to manage some of these medical emergencies. Skills from as simple as a pulse check to chest compressions, basic life support, bag mask ventilation, defibrillation, oropharyngeal tubes. Yeah, so there are lots of different procedures. Some of them are more high risk, perhaps, to get COVID-19. But the main one that we all know is CPR, a life-saving treatment that you use chest compressions and assisted ventilation in an attempt to support a critically ill person's breathing and circulation. The UK Resuscitation Council described CPR as an aerosol generating procedure, and they say that it can endanger healthcare workers. It is now becoming clear that in the time of COVID, there are now ethical dilemmas facing us. These dilemmas are things like performing treatments on resuscitation on individuals in the time of COVID, thereby potentially saving a life, but at the same time endangering yourself and others. By treating a patient, you might get COVID, or the people around you might get COVID. But then again, the other side is withholding treatment or resuscitation, leading to a patient's demise, but at the same time avoiding exposure to COVID, thereby potentially saving the doctor, nurse, or dentist's life. So this is a weighing up of different factors, deciding what is the ethical thing to do. These are difficult questions, but luckily there are organizations that help us make these decisions, what are the right things to do. In South Africa, like the UK, we do have a resuscitation council, And they say they recommend CPR if there's a suspectedly immediately reversible cause. Now, they're saying that if someone has an arrhythmia or a blocked ET tube, this is reversible, you may perform CPR. But then they also mention that the safety of healthcare providers should be taken into account. And they mention appropriate PPE, PPE standing for personal protective equipment. This is a word that throughout the rest of the lecture, you are going to be hearing a lot about personal protective equipment. The Resuscitation Council speak of two scenarios in which resuscitation for COVID patients may take place. They're talking about an in-hospital cardiac arrest, and they're talking about an out-of-hospital cardiac positive patient that is experiencing an arrest. In the dental office, it's difficult to say, is this an in-hospital or an out-of-hospital? It depends about the equipment that is available in the dental office. Is the dental office inside a hospital building? So this is also very debatable about what is a dental office, what sort of equipment is there, what needs to be done. This is what they say about the in-hospital COVID resuscitation. They're talking about protocols that have plastic sheeting covers, viral filters, video laryngoscopy, supraglottic access. These are all things that will not be available in your standard dental office. And then they say, if safety protection is not timelessly available, do not attempt advanced airway interventions. They're saying if you don't have your PPE, be careful. The Research Council of South Africa then also state that most patients with COVID requiring CPR have already progressed to multi-organ failure, and CPR has not been shown to be beneficial. They're saying that if an individual requires CPR, they usually already have multi-organ failure, and that giving them CPR is not going to help them much. And then they go on again talking about the immediately reversible causes. They're saying that if there's something that can be corrected quickly, that was preventable, then CPR is warranted. And therefore, they also go on, therefore appropriate PPE measures need to be ensured. They're saying that even in these circumstances, you need to protect yourself with the correct PPE. Going into out of hospital cardiac arrest, this is what the Resuscitation Council mentioned on their website. They say, we recommend against starting conventional CPR in unwitnessed cardiac arrest. Don't do it. Conventional CPR, as per their guidelines in witnessed cardiac arrest, may not be beneficial in highly suspected and confirmed cases of COVID-19 requiring resuscitation. If CPR is to be attempted, appropriate PPE needs to be enforced, again limiting the resuscitation attempt to an easily identifiable, reversible cause. Sorry, we just skipped a slide. Let me just go back. The safety of the rescue is of paramount importance. We encourage emergency medical systems to enforce appropriate PPE. Again, they're saying protect yourself, you must have PPE. So all these protocols, you must be able to protect yourself and you must have the appropriate PPE. Then this algorithm was also on the Resuscitation Council's website. And you guys can go through this in your own time. But the first thing that is obvious is that put on full PPE, double gloves, gown, and visors. And then they go on basically mentioning a lot of things that is aimed at protecting the rescuer from getting the COVID virus. Yeah, Let's go over to the next slide, and this is just another, this has the Resuscitation Council's emblems on it, and they also go through the 3 H's, and then they go on by saying, have you been in recent close contact or living with the person? This is to say yes. Has the person shown any signs of COVID prior to collapse? So you have to find out what is the risk of you transmitting COVID to yourself and to other people. Interesting here is if it says yes, then they give you the option to go ahead with mouth-to-mouth breathing. They say fold a towel, cloth, or suitable substitute 3 times and place it over the person's mouth and nose to help reduce the risk of possible COVID-19 transmission. So if you feel safe enough to do that, and you feel that you really want to perform resuscitation, they have given you options what to do, but at the end it's still your own choice what you would like to do in a resuscitation. Right, and now the big slide is the PPE. What I've already told you guys what it stands for. It stands for Personal Protective Equipment. PPE means any device or appliance designed to be worn or held by an individual for protection against one or more health and safety hazards. This is from the World Health Organization, and they are very much pro the rational use of personal protective equipment for coronavirus disease. This is their interim guidelines. They say that PPE must be rationalized and appropriate. PPE should be used based on the risk of exposure. In other words, the type of activity you are performing. Are you taking a patient's pulse or giving a patient an asthma pump, or are you performing CPR and causing aerosol? They also talk about the transmission dynamics, contact droplet or aerosol, and they say that the overuse of PPE will have a further impact on supply shortages, especially in South Africa, where a lot of us are in the third world setting. We are at risk of running out of PPE. They say that observing the following recommendations will ensure that the use of PPE is rationalized. Then they say the type of PPE used when caring for COVID-19 patients will vary according to the setting and the type of personnel and activity. Healthcare workers involved in the direct care of patients should use the following. This is just simple care, no aerosol producing. They say you must have a gown, gloves, medical mask, and eye protections. Now, the big thing with the dentistry is the aerosol generating procedures. Here they mention tracheal intubation, but this is not for us. They don't mention here dental drills, but it is exactly the same. It will cause aerosols. They say we should use respirators, eye protection, gloves, and gowns. Aprons should also be used if gowns are not fluid resistant. So they're recommending fluid resistant gowns. But if you have a normal gown, then you can just wear an apron with it. Yes, and now about the respirators, the N95 mask, FFP2 or equivalent standards. There's been a lot of controversy about how quickly you should replace it, if you can wear it for a few hours or only on one patient. And this is what's said on the WHO website. They're saying respirators have been used for an extended time during previous public health emergencies involving acute respiratory illnesses when PPE was in short supply. This refers to wearing the same respirator while caring for multiple patients who have the same diagnosis without removing it. And evidence indicates that respirators maintain their protection when used for extended periods. But they also say, however, using one respirator for longer than 4 hours can lead to discomfort and should be avoided. So you can wear it for for a while. And in conclusion, yes, 2020 came as a big surprise to all of us. Dentistry is an aerosol producing profession by nature. And this has sparked a lot of anxiety with regards to COVID. Your protection is PPE is your protection, no matter what the procedure. There are just different grades of PPE that you must be aware of. And then you must use your discretion when you are confronted with a medical emergency. Are you wearing the correct PPE to protect yourself? And if not, it is advisable that you get the appropriate PPE to protect yourself and then also to prevent transmission to your other patients that you will be seeing as well. Thank you very much.